Good day, everyone. We are the Cyclic squad, and today we are presenting VukaMed, our AI powered wound assessment platform developed under the category of well-being and safety. Our team members are Bjorn, myself, Kaylin, Daniel, and Oscar. VukaMed was inspired by real healthcare challenges we observed during community service work in rural KwaZulu-Natal, where delayed access to healthcare can quickly turn minor wounds into serious medical emergencies.
The problem we noticed is infections in rural KwaZulu-Natal, caused by limited access to affordable healthcare monitoring and infrastructure. During our community service experience, we witnessed firsthand how difficult healthcare access can be in many rural communities across KwaZulu-Natal. Many people travel long distance to clinics, often with unreliable transport and limited access to healthcare workers. In some areas, infrastructure challenges like poor roads, water shortages, and unstable electricity make healthcare even harder to access. As a result, wounds that could have been treated early are often left unmonitored, leading to infections, complications, and unnecessary hospital visits. This showed us that the problem was not only medical, it was also technological and infrastructural.
This problem matters because our community service experience revealed the human impact behind healthcare inequality. We saw how limited healthcare infrastructure directly affects vulnerable communities, especially those living far from clinics or hospitals. Something as small as a cut or untreated wound can become life threatening if it is not monitored properly. The issue is not simply about healthcare access, it is about preventing avoidable suffering through earlier intervention and smarter healthcare support.
This is where VukaMed comes in. VukaMed is an AI powered smartphone platform that helps identify wound related risks early and guide users towards appropriate care. Using a normal smartphone camera, the app analyzes wounds and identifies possible signs of infection or complications. The goal is simple: identify the problem early, assist with monitoring, and help users know when medical attention is needed before the condition becomes severe.
The process begins with input. The user takes a photo of their wound and answers guided questions about the injury. For example, how deep the wound is, its color, what caused it, whether the object was clean or dirty, and whether there is discharge or swelling. Next comes processing. The AI analyzes the wound image and compares the characteristics to patterns associated with infections and wound complications. Then comes decision making. The system identifies possible risks by comparing wound data to known conditions, such as bacterial infections or cellulitis. Finally, the output stage provides users with clear recommendations and next steps. For example, the app may advise wound cleaning, monitoring symptoms, or seeking urgent medical care if warning signs worsen.
VukaMed was inspired by the healthcare challenges observed in rural KwaZulu-Natal, where delayed clinic access and limited wound monitoring often lead to severe infections. We identified an opportunity to use smartphone technology and artificial intelligence to create an affordable, community accessible wound assessment platform for early detection and remote healthcare support. VukaMed benefits patients, community healthcare workers, rural clinics, and underprivileged communities by improving access to early wound assessment and continuous monitoring. The platform helps reduce delayed treatment, severe infections, unnecessary travel to clinics, and pressure on healthcare facilities, while empowering communities through affordable AI assisted healthcare support using ordinary smartphones. VukaMed also has the potential to scale across rural communities throughout KwaZulu-Natal and eventually across South Africa and other underprivileged regions in Africa. By transforming ordinary smartphones into AI-powered healthcare tools, the initiative could improve early wound detection, reduce preventable complications, strengthen rural telemedicine systems, and expand access to affordable healthcare for thousands of vulnerable patients.
First, we begin with input. Imagine a nurse entering details about a patient's wound, how long ago it happened, the temperature, pH, moisture, redness, swelling, and discharge. These numbers might seem small, but together they tell a powerful story about healing or infection. Next comes processing. This is where AI steps in. The system analyzes every piece of data, comparing it to healthy ranges and identifying warning signs. It doesn't replace the doctor, it supports them, highlighting patterns that might otherwise be missed. So here is our solution, working in real time. We move to a decision based on the analysis. The AI determines the wound status. In our example, the system detected early warning signs: yellow discharge, moderate swelling, and severe redness, indicators of possible infection or cellulitis. Finally, we reach our output. The AI generates a clear report. Advice to clean the wound, rest, elevate, and see a healthcare provider within 24 hours. It transforms raw data into actionable care, fast, accurate, and accessible. This process shows how technology can empower healthcare workers, not replace them. AI becomes a partner, guiding decisions, improving outcomes, and ensuring patients get help when they need it the most.
VukaMed was designed with responsible AI principles in mind. It promotes fairness by making affordable wound care support accessible to underserved communities. However, we also recognize the ethical risk that AI systems may become less accurate if training data does not represent all skin tones, wound types, or community conditions equally. It is inclusive because it is designed for patients, caregivers, and healthcare workers, regardless of income or location. Safety is prioritized through early risk detection and guidance towards timely medical care. The platform also emphasizes transparency by providing users with clear explanations and understandable recommendations. Patient privacy remains important, with secure handling of wound images and healthcare information. Finally, VukaMed supports accountability by assisting healthcare professionals rather than replacing them, ensuring human oversight remains central to patient care. We also recognize that over reliance on AI could create ethical risks if users ignore professional medical advice, which is why clinical judgment must always remain the final authority.
In conclusion, VukaMed is more than just a healthcare app. It is a community centered solution that combines artificial intelligence, accessibility, and healthcare innovation to address real world problems faced by underserved communities. We believe technology should not only be advanced, it should also be accessible, impactful, and designed to improve lives where it is needed most. Thank you for listening. VukaMed,
VukaMed,
making the impossible possible.